Hello guys, welcome back again to my channel. I'm really hoping that I'm honestly in frame. I'm Nikan MD. In case this is your first time of seeing me, I'm a lifestyle content creator as well as a medical student studying in Nigeria. This video guys, I'll be talking about pharmacology. 400 level class, you do pathology and pharmacology alongside some other courses, which I have done a video on, like just describing how the class works and how the posting works and all of that. So in today's video, I'll just tell you about pharmacology. So for pharmacology refers to the study of drugs. When it comes to the study of pharmacology, you're expected to know so much, so much. And I think the fact that you're memorizing these drugs and the fact that you don't use these drugs daily, right, I think it kind of affects the learning process. If it's drugs that you come across daily, maybe it will stick better and it will last longer because you know you are prescribing these drugs or you're seeing these drugs, which is like what comes basically repetition, basically repeating, seeing the drugs, administering the drugs will just stay, right? But for the fact that you are in 400 level medical school and you're doing pharmacology, you are not seeing these drugs every time and you're memorizing so many drugs at the same time. I would say one other thing that can help is maybe your postings. Maybe you can hear drugs that are being prescribed in your posting, but that does not solve all of the problems because you have not done psychiatry posting. So when you come to antipsychotics, antidepressants, you can't relate. I know, like, that is the struggle I faced. Like, I couldn't relate to these drugs and I kept on mixing them up. When you mention haloperidol, instead of me to be thinking antipsychotics, I'm thinking antidepressants. And when you're now saying things like maybe you're saying things like fluoxetine or paroxetine, when I should be thinking about antidepressants, I'm thinking antipsychotics. So like, and the drug names are very different. Like, you hear things like fluoxetine, paroxetine, citalopram, escitalopram. These are all antidepressant SSRIs, but their names are so different. The same thing with antipsychotics. When you come to antipsychotic, you are hearing a lot of drugs, right? We have typical, atypical. Like, when it comes to CNS pharma, I feel like that was the most hated because like the drug names were different, from quatipine to risperidone. Like, they don't even sound the same. That is one of the major issues with CNS pharmacology. But pretty much other aspects of pharmacology was quite like that. I enjoyed diuretics because the drug names sounded the same, right? The same is this surfaces. So I'm just going to give you some of the hacks, right, that I think could help, as well as tell you what I did during my time. So when it came to pharmacology, I thrived more with videos, to be honest. I watched videos for a living, guys. I watch videos for a living, whether it is Kaplan, whether it is YouTube, whether it is but my most watched video is a video by a man called Rajiv Pantel, right? Yes, he's a doctor, but I think his specialty is in pharmacology. You don't find his videos on YouTube. Funny enough, I don't know if you will find it on YouTube, but last I checked, you don't find his videos on YouTube. You might get his videos on Telegram. Emphasis on might, because I really didn't even see his videos like that on Telegram. Where I got his video from, guys, but I'm sure if you search on Google, you would find links to his videos somehow, right? So what happened is that I got a link to his video, which, like I said, is not even meant to be shared, to be honest, because like you have to really pay like for a subscription. I don't know that it's Maru or, but anyway, it's an Indian subscription. It's kind of, the man is Indian, so it's like an Indian subscription type thing where you are actually meant to subscribe to access his videos, but his videos were like uploaded to a link like that, and lucky enough for me, I was able to come across it. And the first time I watched his video, I fell in love with it. So that was what I watched over and over and over and over and over. Please don't ask me to share his link, because I don't think I'll be doing that, to be honest, because I know like the link has been banned so many times and all of that. but I'm sure like if you Google his name, Rajiv Pantel, you would come across a link to his video or something, right? Or yeah, so his own video was the video that I binge watched. Guys, I watched this man's video. He has videos on almost, okay, I know it's his anti-cancer section that he did, like the video this thing that I got. Like I didn't get a lot of his anti-cancer drug this thing videos, but like his video was super good. So I recommend, if you're a video person, please watch videos. Then there's speed pharmacology that tries to, you know, inculcate this. So the what I liked about speed pharmacology is where you can access it on YouTube, number one, and the fact that they try to use visual aids to kind of help you. But the issue I had was that the videos were quite short and it didn't cover everything, right? But I think it just covered just enough, but like I said, it didn't cover everything. Now for textbook, I will recommend Lippincott textbook is so good. I just that for me, I really didn't read Lippincott like that. I read medical pharmacology for medical graduates, or is it pharmacology for medical graduates? That was the book I read. I read that as well as Lippincott. Why I read medical or pharmacology for medical graduates was that it was more simplified. They used flow charts, which I love. I love visual representation of things. They used flow charts. It was shorter to read and all of that. So I read that, as well as I also read Lippincott. Lippincott is a beautiful, good book, especially when it comes to the anti-cancer session. I think I will still read that again because I really enjoyed the anti-cancer session with the cancer man. Like, it was very interesting to read. So I think Lippincott is a great book. I also tried out Katsung and Trevor, but the summarized version, not the main Katsung, and because Katsung and Trevor there's a bigger version, a bigger book, but there's also a summarized one, which is the review. Yes, I read Katsung and Trevor review, and it was very helpful. So one of the things that I would say 100% of the time that actually helped me in pharmacology was the fact that I actually started reading before I resumed. Like, I don't care what people say. People will say, oh, why are you reading with your break? Why don't you just sit down, enjoy life? That saved my life. That saved my life. Because once I resumed, I was 10 times ahead of my mates. When it comes to pharmacology, that does not mean you cannot read it that time and understand the pharmacology. My mates did it. There's nothing different. But when it came to pharmacology, I've heard the drugs before. So it was very easy for me to memorize. Pharmacology was not majorly a struggle for me, like, because I had done the work prior. So when I came, it was just more of like trying to consolidate what I've heard and trying to gain more understanding. So that really helped me a lot. Please don't allow anybody to deceive you that, oh, you don't need to do it. If you want to do it, study with your break if you want to study with your break, because I saw that it really helped me. Now, people coming to pharmacology already believing that it's hard, which is the beginning of the problem, because even the simpler things appear daunting, appear difficult, because they already have this preconceived notion that the course itself is hard. Number one. Number two, you have to understand that these drugs are not just for you to memorize. 100, almost 50% of pharmacology, or 60% or 70% is rote memorization of these drugs. But you have to understand that these drugs, right, they have actual function, right? They are used by real doctors on real patients in real life. That is why I say going for hospital postings and looking at, when you go for your hospital posting, look at the drug list that is being prescribed. You get to see some of the drugs that you're learning, right? That tells you that this, for you to know these drugs, is very important. Once you see the importance of what you're doing, right, pharmacology will now become easier for you. Now, number three, there's a outline. When you're learning any drug, there's an outline that you need to know. Number one, right, I would say introduction of a drug. It's just like how you write your essay. Introduction of a drug. The introduction usually carries the drug, the prototype drug. Like, for example, we're talking about beta blockers now. The prototype drug is propranolol, although there are other variations. Like when you're talking about cardioselective, and I'm talking about non-selective beta blocker. Like, there are other subdivisions, right? But like, there's a prototype drug, so you should know the prototype drug for every drug family, for every drug class. Try and know the prototype drug. When you're done with that, the next thing you need to know is the pharmacodynamics and pharmacokinetics, which is, for the pharmacodynamics, is like drug on body, which is most of the time the mechanism of action of that drug. So mechanism of action of the drug is very important because that is what is going to influence your choice of usage of that drug. For example, let's say I'm treating a patient with maybe depression, for example, and I want to give an antidepressant. And I know, like, for most depression, although, like I said, there are variations, right? But for most of the treatment regimen for depression, they usually like giving the SSRI, which is the selective serotonin reuptake inhibitors. An example is fluoxetine. I know that fluoxetine is one of the major drug of choice or prototype drug in this class. So if I learn everything under fluoxetine, I have a fair knowledge of what other drugs most likely would do. So what I will just do is to be very, like, having the little mini changes associated. For example, now when I'm talking about fluoxetine and I say, okay, this is the mechanism of action, I know the same mechanism applies for all other drugs that fall under this SSRI class, like citalopram, paroxetine. Then when it now comes to, like, other things, like, for example, now side effects. Now when you're done learning the mechanism of action, the next thing is pharmacokinetics. Pharmacokinetics refers to the absorption, the distribution, the metabolism and excretion of a drug, ADME. You have to know these things, to be honest, because when you're speaking to a pharmacologist, they want you to speak from that point of view. When you're writing your essays, you're expected to follow this format. You start with the introduction, you talk more about the drug family or the prototype drug, right? You just mention it there for them. Then you move on to the mechanism of action of the drug, which is the pharmacodynamics. You tell us what it does, where it acts on, which receptor does it act on. Is it a GS receptor? Is it a GQ or a GI receptor? If it has any of that interplay, you mention it. If it doesn't, then that is fine. Then you move on to the pharmacokinetic. You tell us the absorption. Before the absorption, you tell us the routes of administration. How is it given? Is it an IM drug? Is it subcutaneously given? Is it an IV drug? Is it an oral drug? Is it given sublingually? Is it given rectally? You just have to know, like, how the drug is given, right? Then after that, you move on to the absorption. How is it absorbed? Is it widely is it 100% absorbed? Like, does it undergo first pass metabolism? Like, things like that. Then you move on to distribution. Most lipid drugs are widely distributed. Is it widely distributed? Is it relative? Is it fairly distributed? You just let us know. The metabolism of the drug. Is it metabolized as cytochrome P450? Is it, most of the drugs are metabolized by the liver, to be honest, but there are some variation, like lipid drugs. I think, yeah, they are still metabolized by the liver, right? But most drugs are metabolized by the liver. And then the route of excretion, most drugs are excreted by the kidneys. So, like, you just need to know this standard. Then you know, like, okay, what are the tiny variations that apply to some of these drugs. So once you're done with that, the next thing that they would look out for is the use or the application of this drug. For example, now if you're telling me about anti-diabetic, obviously one of the use will be in DM. But now diabetes mellitus, but now which type? Is it a type 1? You know, for diabetes mellitus type 1, usually the drugs that are used there are insulin. Insulin is one of the major drugs used in type 1 diabetes mellitus. Then for diabetes mellitus 2, right, type 2, that one is most likely oral glucose lowering drugs, where we have our number one drug of choice there is metformin, right, which is a biguanide. So, like, these drugs, you just really have to know it. Then you tell us the use. Which other condition is this drug used? Is it, like, even for the oral glucose lowering drug, can be used in acromegaly, can be used in metabolic syndrome? Like, you just understand, like, just let us know where these drugs are used, right? Then after that, you move on to the side effects of this drug. Aside from GIT, because most drugs will cause nausea, vomiting, GI disturbance, headaches. Most drugs will cause this. So most examiners don't want to see that as your first 5 side effects. Try and know their specific side effect for drugs. So when you're learning a drug, ask yourself, what is the specific side effect attributed to this drug, or what is this drug commonly known for, right? So for example, now for metformin, one of the major side effects is lactic acidosis. Then for insulin, is usually hypoglycemia. Like, that is one thing that doctors are really scared of. Then for paroxetine in antidepressants, is suicidal thoughts in children. That is what psychiatrists are scared of. Suicidal children having suicidal thoughts. Then we have, like, there are certain drugs that have these peculiarities, right? Even when you come to anti-diarrheas, and there are certain drugs too that, like for anti-diarrheas, one of these major side effects will be constipation, right? So if there are side effects, please take note of that. Then you move on to adverse effects too. So it's very important that you know that, like, side effects are like the expected effects, right? That are usually given with this drug, while adverse effects are like effects that are not expected, right? So, and there are different kinds of adverse effects, from very extreme to, so try and know, like, the differences. Like, if you're given a sulfur containing drug, one of the adverse effects that they would want you to make mention of is allergic reactions. Steven Johnson syndrome is one of the worst things that most doctors are scared of, so they would even want you to mention that first, right? So when you're done with that, I think you are done with the major bulk of it. Then the rest can be maybe conclusion and all of that. So when you're learning any drug, try and, like, know it from this understanding. If flashcard work for you, please use your flashcards. I know, like, what works for me in pharmacology is not flashcard actually. Flashcard could help, but, like, it didn't really help me so much, maybe because I didn't give it so much of a chance. But I know, like, flashcard works for people. I've seen it work for people, so, like, I know flashcard works. Then what works for me actually was doing practice question. So what I used to do was that after learning a topic, I can go on ChatGPT, for example, and I will tell ChatGPT to ask me questions, USMLE or PLAB, which is the UK and US exam standard type questions associated with this drug. So then I would attempt to answer these questions. Then I even got this, there's a USMLE book. There's a USMLE book. I've forgotten what it was called, but it's a pre-test. Yes, USMLE pre-test pharmacology. Questions there are tough. To be honest, they are tough, but, like, if you can answer the questions there, you're ready for any, like, pharmacology exam. So that's what I used to do. I'll answer the question there. I'll try and read fast, go through my course content as fast as I can, try to write down these drugs. I hate writing, to be honest, but pharmacology was a course that I had notes for, like, from even watching Dr. Rajiv videos and all of that. Like, I tried to, like, just write these drugs down. Then I would go and try and answer questions on pre-test. So now, because of the level of difficulty, I'm forced to think and retrieve this information. So that was my method of active recall. And like I said, the questions, they are really tough. They are tougher than your regular pharmacology exam, to be honest. So after going through that much pain, there's nothing that I'm seeing in my exam paper that is going to shock me. Like, I've seen the worst type of shock already. So that was one of the things that actually helped. Then you can go online and sort for quizzes. To be honest with you, the only way you get better at pharmacology is by practice. Now, for pharmacology, I even employed the use of, because I'm a member of the Christian Medical and Dental Association, and I'm even my class academic secretary. So basically what I did was that I employed some of their tools, like, what have you read today, where you ask yourself, like, if you see your classmate, you ask your classmate, what have you read today? So we did that for pharmacology too. I asked you, what did you read in your pharmacology today? Do you want to talk about it? Okay, tell me about the drugs that you read. What is the mechanism of action of this drug? What is the major side effect for this drug? Is there any adverse effect I should be worried about? Is there any drug-drug interaction? Because another thing I forgot to mention, you need to know drug-drug interaction. Like, for example, if you're talking about monoamine oxidase inhibitor, I'm so sorry, I'm talking about CNS, because I read CNS so much. Kai, we're talking about monoamine oxidase inhibitor. I know that those drugs are not meant to be taken with cheese. You don't advise because, or tyramine containing food. You don't advise any of the patients to consume such drugs with cheese because of the risk for hypertensive crisis. Because it causes excess amount of release of catecholamines and can fuel the patient to having very high blood pressure, and the patient can move into crisis. So that is one of the problems. So like there are certain things like that. Then there are some drugs that like should not be given if fertility is an option. Like for chemotherapeutic drugs now, some of their side effects is going to be infertility, to be honest with you. Some of their side effects is going to be infertility, so that is something you have to consider. So I would then certain drugs too are not meant to be taken with certain like I think, is it metro or is it doxycycline that you don't give you in milk? Like certain drugs should not be given together with certain foods or certain drugs, like because of the drug interaction, especially when it comes to, so you have to know cyclone inducers, cyclone inhibitors, things like that. So guys, I hope I've not been rambling too much, but those are some of the things you need to be aware of. So you have to ask yourself questions, like don't be shy. When you come to school, you have that friend, ask that friend, let's discuss pharmacology because these drugs are getting much. What drug did you read? Can you tell me about the drug? Can you tell me about the mechanism of action? So when you're doing that consistently, like it helps these drugs to stay. Now, always, like I said, keep practicing, like go online, answer quizzes. It's just continuously engage, continuously try to retrieve these drugs from your memory, continuously try to recite, continuously try to tell people about it. Somebody once told me that if you want to be sure you really understood something, teach someone. Honestly, like teach someone about it. So that is how I think that is most of how pharmacology works. Right, I've talked about how you would answer their question. I've talked about some of the resources that are available to you, and like I said, these are not the only ones. You can find much more resources, like past medicine. Past medicine is one of the best resources, but it's like PLAB, channel to what UKMLA standard, but like do past medicine too is my love. Like it's my love. So you can also do past medicine too, and it's quite free. You just have to register on the site. Then I've also talked about techniques that I use. I said flashcards could work, but for me it's answering quizzes, failing these quizzes and trying to figure out why did I fail this quiz, and correcting myself, trying to fill up my knowledge gaps. Right, and like I said, it's good you have a visual represent, something that you can go back to. I didn't like writing, so what I normally do is I look for summary notes online. To be honest, there's med notes, there's I know there was med notes, then there's One Touch Pharmacology book by Dr. Rajiv Pantel. He has One Touch. The book is so like a summary of all the pharmacology, but you can't start reading that book because like you have to have had knowledge before reading that book, because like a summary is like a revision tool, so that helps. But aside that, please, like I said of this video by telling you that it requires a mindset shift. You can't be thinking that the course is hard and you expect it to be easy for you. You have to have that mindset shift. So once you have that shift, like everything starts falling into place and things start coming to your understanding more and more. So guys, this will be the end of today's video. Please, if you have done this class and you have advice or tips as regards pharmacology, please leave it in the comment section for your juniors below so that they can also learn, because this community, we don't gatekeep, we help one another. So let's leave the advice in the comment section. I'll also be in the comment section reading and responding to your comments. Until next time guys, bye.